so attendees can't record. But if you have the capability to do so through some other type of screen recording, you are permitted to do so. We will be sending you a high quality recording of the press conference immediately after the event concludes. And I'll put my contact information in the chat. Please feel free to reach out to me with any questions or requests. You don't have to request for the video. I will be sending you that, as well as Dr. Bagdasarian's slides after the event concludes. So with that, I'm going to turn things over to Director Hertel.
Thank you, Andy. Hello, everyone. Today, I'm joined by Michigan Chief Medical Executive, Dr. Bagdasarian, and by Dr. Yagella to provide an update on COVID-19 in Michigan. As you know, and as some of you may have personally experienced in recent weeks, we continue to see the rapid transmission and a dramatic rise of COVID-19 cases, which include the Omicron variant. Dr. Bagdasarian will go into further detail on this week's trends and the wave of infections that we need to expect and be prepared for in the coming weeks. We knew there was a potential for increased transmission before and during the holidays in December. We shared that with you, and we saw those increases, though not to the levels that I expected. And that is because Michiganders did their part, including what they could to limit travel, gather safely, and get tested. And I want to thank all of you for that. Before we get into detail, though, I think it is really important that as we experience this next phase of COVID and we start this new year, that we start with patience for our healthcare providers and continued patience with each other. With the continued transmission of the Delta variant and the exponential spread of the even more contagious Omicron variant, we're heading toward what will likely be a very sharp crest in this wave of cases, while still seeing our hospitalizations increase. To lessen your risks of getting COVID and the potential for severe infection, to avoid disruptions to in-person learning and the economic ramifications that come with so many people getting sick and needing to stay home or quarantine, and to try to ensure that our health and hospital systems have the capacity to treat you quickly when you walk through their doors for an emergency, including non-COVID conditions. It is critical that every person in this state continues to take steps to stay safe. As of this week, based on the daily pediatric hospital census, hospitalization of children have increased after last week's all-time highs. People in their 20s and 30s are experiencing the highest case rates of any group. And while breakthrough cases are to be expected with Delta, and given the much greater transmissibility of Omicron, people who are unvaccinated are still fueling the surge in cases, but most especially hospitalizations and deaths. Our actions to address these increased cases and drive trends down in 2022 are based on our three main strategies, which is preventing deaths and severe outcomes, protecting our healthcare capacity, and keeping vital infrastructure, such as schools, functioning. So we are continuing to work with our federal officials to support hospitals and their staffing needs. There are now 5 federal teams mobilized to assist with staffing and patient care at Beaumont Dearborn, Spectrum Butterworth, Covenant Healthcare, Mercy Muskegon, and Henry Ford Hospital in Wyandotte. We continue to work with federal partners on the availability of additional teams to support hospitals. We're deploying an additional 200 ventilators that we've received from the National Strategic Stockpile, and we're working with local health departments and other partners to continue to hold vaccination clinics for the community, schools, and we added pediatric vaccination to our community-based testing and vaccine locations. More than 5.7 million Michiganders are fully vaccinated, and over 2.5 million booster doses have been administered. This is a huge accomplishment, but we need more initial shots in arms, and boosters are so incredibly important in the fight against Omicron. Again, school districts should adopt or maintain universal masking to layer strategies that prevent the spread of COVID-19. We're continuing to make testing available to students, their families, and school employees through the My Backpack program, 337 school districts have expressed interest in this program, and we are onboarding new districts every day. So far, this program has allowed us to distribute 175,000 over-the-counter test kits directly to Michigan families. We're also continuing the MySafe Schools testing program, which provides free rapid antigen testing in K-12 schools. Over 1.4 million antigen tests have been distributed to schools since 2020. And already this year, more than 72,000 rapid antigen tests have been distributed to schools to support that test to stay protocol. This week, we're expanding testing resources for other households by distributing free at-home tests to some public libraries. In the initial round, testing kits will be made available at library locations in Detroit, Farwell, Harrison, Homer, Frankenmuth, Hesperia, White Cloud, Hart, Taylor, and Pentwater. Details will be announced soon so people know exactly when and where they are available. These efforts to distribute at-home and over-the-counter test kits build on the 5,731 testing events and 323,000 tests at points of entry, community, and neighborhood sites that we've supported over the last year, as well as the record number of tests performed at department-supported community and travel sites last week. We look forward to expanding the number of kits available at each library location and partnering with additional communities and other partners. In addition, we're beginning to coordinate the allocation and monitoring of new COVID therapeutics, and I will let Dr. Bagdasarian speak to that in a moment. For our state to avoid a sharp rise with this next wave, for this to work, starting now and for the next several weeks, we ask everyone to continue to keep their guard up and take actions. We cannot do this with state and local health department action alone. So please be extra vigilant and layer protection. Get vaccinated and get your booster when you and your children are eligible. As of last week, everyone aged 12 and up is eligible as early as 5 months after a second dose of Pfizer or Moderna and 2 months after Johnson & Johnson. Whether you are unvaccinated, vaccinated, or received a booster, it is still important to wear a mask whenever you're in a public setting. We recommend that you upgrade to a well-fitting K95 mask or wear 2 well-fitting masks for increased protection. Avoid large gatherings, wash your hands regularly, and if you test positive, tell your close contacts right away and make sure that you remain isolated. If you feel sick, you think you may have been exposed to COVID-19, take steps to keep others around you safe. If you receive those 2 doses of Pfizer or Moderna more than 5 months ago, or the J&J vaccine more than 2 months ago, but you have not received a booster, or if you are unvaccinated or not up to date with vaccines, start quarantining right away, even if you don't receive a call from the health department, and make sure you get tested. If you received 2 doses of Pfizer or Moderna within the last 5 months, the J&J vaccine within the last 2 months, plus a booster, or if you've had COVID-19 in the last 90 days, watch for symptoms and get tested. If you do experience a health emergency, you should seek care. Go to an emergency room. However, if you are seeking non-emergent care, an urgent care or your primary care provider probably is your best option. At-home tests or COVID-19 test sites, not emergency rooms, are the best option to get tested. And you can visit michigan.gov/coronavirus test to search for a testing location near you. All of these precautions in combination is what it will take to help slow the spread of COVID-19 today and weather what could be coming. Now I'd like to hand it over to Dr. Bagdasarian to talk a little bit more about trends and what we should expect into the next month.
Thank you so much, Director Hertel. I do have some slides to share. Thank you, Mandy. Maybe we'll start up at the top. Thanks. I'll start with my first slide. I'll start with an overview of where we are in the metrics that we've been following very closely since the beginning of the pandemic. And my overall message really this morning for you is that this surge is not like the others. I'm sorry, I've lost my first slide. There we go. When we look at our new cases, our weekly cases per 100,000, we're now at a point that we have not seen through this pandemic. This is the highest number of weekly cases we've ever had, 129,937 weekly cases in Michigan. When we look at our percent positivity, we are up to 33.2%. This is a number that we have not seen since the beginning of the pandemic when tests were very limited. And then when we look at hospital capacity, we're at 21.9% of our inpatient beds filled with COVID-19 positive individuals. And again, the numbers that we've seen during this surge have not been seen at earlier times of the pandemic. Next slide, please. When we look at where we are today versus where we are last year, so that's the red line showing where we are today versus the blue line where we were last year, you can see that we had a similar holiday surge. What happened very recently in the last few weeks looked similar to what was happening in the 2020 holiday surge, but cases went down after that 2020 holiday surge. And at this time last year, we were in a really good position. Our cases during this surge, when we look at the red line, are again the highest that we've seen through the pandemic. So we're in a very different place than we've been before. Next slide, please. Next slide, please. Our case rate trends are going up across all age groups, and our case counts are highest for those who are 20 to 29-year-olds. Now, this really ties back to what we're seeing in our vaccination data, where we're showing that younger age groups are less likely to get vaccinated. Next slide, please. When we look at our statewide hospitalization trends, we know that things are bad across the state and that hospitals are under a great deal of strain. But I would like to point out that things are exceptionally severe in regions 2 north and 2 south, where they're seeing greater than 400 per million population hospitalized. So those are the 2 regions that have been hit the hardest in some previous surges and have been hit the hardest now. Next slide, please. Our average hospital admissions are increasing for all age groups. And if I could go to the next slide, I want to focus on what's happening with our pediatric hospitalizations. We currently have 107 children in Michigan hospitals from our daily hospital census. Each day we have 22 new pediatric admissions, and admissions are 66% higher than the week of December 20th. You can see this curve is really troubling. And again, we're very concerned, especially given what we know about vaccination uptake in younger age groups. We know that pediatric vaccine uptake is not where we need it to be, and so children are at risk for some severe outcomes. Next slide, please. I want to talk a little bit about where we're heading. And I'd like to share with you some modeling updates. This is actually something taken from the COVID Modeling Scenario Hub, which combines models from academic institutions around the country. And these ensemble models have a variety of different scenarios. I'm showing them all to you, from the most pessimistic to the most optimistic. So what you're seeing is for cases, hospitalizations, and deaths, where we are now are the little black dots at the bottom. If we first look at cases, what we're expecting is a very sharp and fast peak. When we look at our most pessimistic model, we're looking at about 200,000 cases per week in Michigan. And in fact, the most pessimistic model does seem to be the most accurate when we look at some of the assumptions behind it. When we look at hospitalizations, again, the most pessimistic model shows a very sharp and fast peak, peaking somewhere around 8,000 hospitalizations. Our most optimistic curve looks similar to where we are now without too much of an increase in hospitalizations. Again, we don't think that that is likely to be reflective of our next few weeks here in Michigan. And the same with deaths. The most optimistic curves are showing us following a similar trajectory to the one that we've been on. However, the most pessimistic shows a very steep increase in deaths. And what we are concerned about And what seems to be perhaps the most predictive are those most pessimistic models. So what these models are not taking into account is the fact that our healthcare systems are already under a great deal of strain, and that adding more cases, even if we didn't add a significant number of cases, adding more cases right now is going to result in further strain and further worse outcomes. Next slide, please. I'll talk briefly about the tools that we have available, and many of these are tools that we've had for some time now. So just putting this all together, I think this is a nice way to think about those tools in terms of preventing severe outcomes, preventing death, and protecting our healthcare infrastructure. The first, down in the bottom left, are, of course, masks, distancing, and ventilation. We know that these are proven solutions that work to prevent spread. What has become more important than ever as we look at Omicron and how transmissible it is that the role of well-fitting, high-quality masks is even more important, especially in indoor or crowded public settings. And so what we're really talking about are masks that adhere well to your face, so masks that form a good seal around your face and that are multi-layered. And those are now more important than ever, as Director Hertel mentioned, especially in settings like schools. Next, vaccines. We know that vaccines protect against severe outcomes and death. The role of boosters is more important than ever, and we now have boosters available for individuals over the age of 12. We really need to make progress in our state to vaccinate and boost those in our youngest age groups. I showed you some data on what's happening with pediatric age groups and what's happening with our 20 to 29-year-olds. And many of these severe outcomes and hospitalizations are preventable with vaccines. Next, I'd like to mention tests. Tests have been part of our toolkit since the beginning. However, we now have over-the-counter tests and antigen tests. I understand that availability of these tests has been a struggle, and we're working with federal partners to increase availability. And as Director Hertel mentioned, we have initiatives all over the state to get tests into the hands of as many people as possible. We really want to encourage testing before gatherings, when anyone has symptoms, or after exposure. And next, I'd like to mention treatments. This is a bright spot in our COVID pandemic situation where we now have the availability of oral antivirals. So there are 2 oral antivirals that have now come into the state and are already being prescribed. We have Paxlovid and Molnupiravir. These are both available in limited quantities and have to be prescribed early in the course of disease in order to prevent against severe outcomes. So we're working to prioritize those to individuals who are at highest risk, either those who are immunocompromised, those who are elderly, and then we've also prioritized some geographic areas of the state that are most vulnerable. So working on getting oral antivirals as part of our toolkit to prevent against severe outcomes. Monoclonal antibodies remain available. However, what we're finding is that 2 out of our 3 available monoclonal antibodies are not going to be effective against Omicron. And so our toolkit is slightly diminished in that regards. But we really need to work together and utilize all these tools, because as I've tried to lay out with the data, this surge is not like previous surges. We're expecting to see many, many more cases. And what we want to prevent are many, many more hospitalizations and deaths. With that, I'm going to hand over to Dr. Lauren Yagella, who is a pediatric critical care specialist from Children's Hospital of Michigan. Thank you so much.
Thank you for inviting me to speak about my experiences with caring for children with COVID as a pediatric critical care physician. I take care of the sickest children in the hospital in the pediatric intensive care unit, who often need life support measures. The majority of the children who contract COVID have a mild illness that can be cared for at home. However, a small portion of children can develop serious and life-threatening illness related to COVID and can require admission to the hospital, including the pediatric ICU. Consistently throughout the pandemic in the pediatric ICU where I work, we have had children admitted with serious and life-threatening illness related to COVID. In this current COVID surge, we are experiencing the highest number of COVID positive admissions to the hospital and the pediatric ICU since the beginning of the pandemic. In the pediatric ICU where I work, we have seen children develop serious and life-threatening illness due to COVID in 3 ways. First, we have seen children develop serious and life-threatening COVID pneumonia. We have also had children develop myocarditis or heart inflammation that causes serious heart dysfunction due to a COVID infection. Here I'm referring to myocarditis caused by the COVID virus itself. Additionally, we've had numerous children develop a condition called multisystem inflammatory syndrome. This syndrome can occur in children around 4 weeks after their initial COVID infection. Importantly, the preceding COVID infection can be mild. Many of these children have serious heart dysfunction. The children we have cared for with COVID pneumonia, COVID myocarditis, and multisystem organ syndrome have often required a variety of medical treatments to help support their hearts and lungs when they are sick. Many have required medical treatments to help their breathing, which have included a high rate of oxygen flow into a child's nose, CPAP or BiPAP, where a child wears a tight-fitting mask over their nose and mouth that provides pressure to help them breathe more comfortably. And some children have also needed a breathing tube and to be placed on a ventilator. Some children have required medications like epinephrine to improve their heart function and raise their blood pressure after it has dropped dangerously low. Some children have required special procedures like the placement of an IV in their neck called the central line that also can go in their groin. Also, we've had a few children whose heart and lungs are so severely compromised that they have needed heart-lung bypass with extracorporeal membrane oxygenation, or ECMO. In ECMO, a child's blood is pumped out of their body to a machine that replaces the function of their heart and lungs. Without ECMO support, these children were likely to die. We've also had many children require admission to our pediatric ICU for moderate illness due to COVID. We've had previously healthy children with COVID develop febrile seizures, or a seizure that occurs in the setting of a fever. We've had children with seizure disorders who contract COVID, who develop status epilepticus, or continuous seizures that are very dangerous to the brain. In children with diabetes, we have had COVID infections lead to their diabetes becoming uncontrolled in a dangerous condition known as diabetic ketoacidosis. And we've had previously healthy young children with COVID develop bronchiolitis, a serious lower respiratory tract infection. We've also had children with asthma develop severe asthma exacerbations with COVID infection. The majority of children we cared for with serious and life-threatening illness due to COVID have recovered. However, these children can be in the hospital from anywhere from a few days to up to 1 to 2 months, depending on how severe their illness was. Further, children who experience a pediatric ICU admission are at risk for lasting impacts on their emotional and physical health. After a pediatric ICU admission, children can have new medical conditions, new disabilities, reduced quality of life, and post-traumatic stress symptoms. We also know that having a child admitted to the pediatric ICU can be very stressful and traumatic for parents. Many parents fear their child may die, and it is traumatic to watch their children need procedures and be so ill. Many parents experience post-traumatic stress symptoms after their child's hospital discharge. Currently, pediatric ICUs across the region are very full due to both the usual seasonal uptick in respiratory viruses that occurs in the winter and with children who have COVID-related illness. Given this busy season, healthcare workers in our pediatric ICU are working very, very hard. We are dedicated to providing the best care for our young patients and supporting their families during a stressful time. There are high levels of stress due to the increased number of patients both with and without COVID. We are doing the best we can to deal with this stress, and we are working to support each other in the numerous challenges that COVID has brought to healthcare. Vaccinating children 5 and older will help protect these children from contracting COVID. As I previously mentioned, COVID can be life-threatening for some children. In clinical trials, the vaccine was more than 90% effective in preventing COVID-19 in children ages 5 through 17. If more children become vaccinated, less children will get sick with COVID and less will need to be hospitalized or require significant medical interventions in the pediatric ICU. My greatest wish is that a child or family never needs the medical care that I provide in the pediatric ICU. Vaccinating children 5 and older will help us achieve this. Thank you.
Thanks, everyone. Thank you, Dr. Yagela. I'm going to stay off camera here, and we have a lot of questions. I'm going to do my best to get through as many as possible here in our limited time. To start, I have a question from Craig Mauger from the Detroit News. What percentage of the recent new cases you are examining are Delta, and what percentage are Omicron? Dr. Bagdasarian, can you address that?
Our information is pulled together from a variety of sources. So we've got our sequencing that we're doing at the Bureau of Laboratories. There's a little bit of sequencing that's being done by the CDC and by other partners in academic institutions. We also look at what the modeling is showing us. So when we look at the sequencing that has been done thus far, it does appear that Omicron is the predominant strain. There is likely to be some difference from region to region. And what we're seeing in 2 North and 2 South indicates that it probably has taken a greater foothold in those regions. When we look at modeling, that also tells us that our sequencing data is likely lagging because it takes about a week plus to do the sequencing. And so we're likely in a situation where Omicron is somewhere around 90% in some regions of the state.
Thank you. Our next question is from Whitney Burney from Wood TV. Are there concerns about the accuracy of rapid testing and the state's ability to keep track of at-home testing numbers? Dr. B, can you answer that as well?
Yeah, that's a great question. 2 parts to that question. So number one, the accuracy of the testing. We know that PCR testing is gold standard when it comes to sensitivity. So PCR is going to be the most sensitive test. And when we're talking about detecting cases very early in disease or late in disease, PCR is going to pick up those cases better than antigen. We have experienced this not only with Omicron, but we've experienced this throughout, as long as we've had antigen tests available. Now there is some concern that with Omicron, the sensitivity of antigen tests is further reduced, especially in early time periods. However, it doesn't take away that these tests are still a phenomenal tool in our toolkit and still deserve to be used. It just means that a negative test doesn't absolutely guarantee that someone doesn't have COVID and isn't going to develop COVID in the next few days. Especially if someone is symptomatic but testing negative, we'd always urge erring on the side of caution. So that's number one about the sensitivity of those tests. The second question was about, I'm so sorry.
Keeping track of the state's
Yes.
ability to keep track of the at-home numbers.
So we're not keeping track of the at-home numbers, and I don't necessarily think that's a bad thing. We're entering into a new phase of the pandemic. This is no longer something that's causing a few hundred or just a few thousand cases around the state. This is something that is really taking off, and the numbers are simply such that I don't think we could even deal with every case. We're also entering into a phase where we need to give our communities and give Michiganders the tools they need to take care of themselves. So that means that if you test at home and you have the results at home and you know how to handle the results of those tests, if you know how to isolate, if you know when to seek medical care, we don't necessarily need to keep track of every single test. And that also moves us to a point where we're keeping track of where we are in the pandemic using different technology, things like wastewater surveillance, things like syndromic surveillance. So as the pandemic moves and shifts, the way that we collect our data and the way we look at the numbers also has to move and shift.
Thank you. This question is along those same lines from Justin Hicks from MLive. What COVID numbers are health officials putting the most stock in as we get this overwhelming record-breaking data in every day? And have we gotten to a point in the pandemic where any data points that were important a year or two ago have become less or irrelevant? You touched on that a bit. Director Hertel, would you like to address that?
Absolutely. We are still following the same data points because they indicate to us what is occurring across the state, where transmission is high, and where we can expect to see spikes, and help us determine how we should be deploying some of the resources that we do have available. With the new variant, we recognize that the number of people being exposed will be exponentially higher than perhaps previous variants. So in this surge, what we continue to keep a close eye on are really the number of hospitalizations, especially given, as Dr. Bagdasarian mentioned, that we are already at a point in time where our hospitals are under immense strain.
Thank you. From Joshua Vinson from WZZM, with so many people vaccinated in Michigan, why are the numbers so high? Dr. B, could you address that, please?
So we know that the vaccines are phenomenal tools in protecting against severe illness and death. That doesn't mean that they will stop every single vaccinated individual from contracting COVID. We also know that there are individuals who are in the hospital with COVID, not necessarily because of COVID, but because of other reasons. So the entire picture needs to be taken into account. But what I can tell you is the people who are sickest with COVID, the people who are in ICUs and on ventilators, it's much more likely that they are either unvaccinated or unboosted. So the role of vaccines and boosters is more important than ever to keep individuals from developing those severe complications.
Thank you. And we did have a question in about updated information on percentages of vaccinated people in hospitals. And I believe that is available online, correct? The updated data on that, Dr. Bagdasarian?
It should be. I don't know it offhand, but it should be updated online. Yeah.
We can follow up for that specific question. When do you think Michigan will receive an additional supply of the antiviral drugs for COVID? This question is specific to West Michigan. When will West Michigan get its first batch? Dr. Bagdasarian, do you have more information on that?
So we already have some idea about numbers, and we're working on plans for distribution and other prioritization. So as we get more antivirals, the distribution plan will change and the prioritization will change as well.
Thank you. This question is from Sam Schreiber with MERS News. Should more school districts be opting for virtual or remote learning based on cases in their area? Director Hertel, would you like to address that?
Given all of the mitigation measures that we know, and layering those measures should help schools stay in person. It's really important, I think, that kids are in school in person as much as possible, both for their own development and learning, and also for their families. So if we can continue to make sure these kids are vaccinated, as well as teachers, they're masking and following the protocols that have been laid out, then I think schools should safely remain in person if they can.
Thank you. From WWMT, does MDHHS have a plan in place for all of the hospitals being overrun or at full capacity? And do you think Michigan will get to a point where there are patients being turned away? Dr. Bagdasarian, could you address that?
I'll say we're working with our hospital partners very closely. We've already brought in some federal assistance for hospitals that were really struggling. We're working on messaging to community members when to seek treatment in the hospital versus when to seek treatment outside of the hospital. We continue to work with them, and many of them have their own plans for crisis standards of care and what they're planning to do if they continue to see numbers that they have been seeing so far. So we'll continue to work with them and support them in any way we can.
Thank you. This is from Mike Wilkinson from Bridge. What percentage of pediatric cases and adult cases are quote unquote incidental in the hospital for other reasons, but testing positive? In other places, it's been as high as 50% in places like California and Florida. Is that tracked at all here? Dr. Bagdasarian, do you happen to have that information?
So we don't have good visibility on that data right now. It would be asking the hospitals to collect another piece of information when they're already under a lot of strain. But what we're trying to do is really look at the picture very holistically. So we're not looking at cases alone. We're not looking at hospitalizations alone. We're looking at the big picture. So that includes ICU capacity. That includes how many people are on ventilators. And looking at that big picture and looking at all of these metrics together gives us an idea, not just of our case surge, but also the surge in severity and the burden to the hospitals.
Dr. Bagdasarian, another question for you. Do you have a best guess at when the current surge might come down?
The models that we've looked at, so these are ensemble models utilizing information and scenarios put together from top academic institutions around the country, funded by the CDC and very similar to CDC models. They're showing that we will likely peak between the end of January to early February. And then after that, things will start coming down. Now, what's really up to us as a state is how high do we want that peak to be? Because I think that if we don't use the tools we have, and we have a lot of tools, if we don't use the tools we have, we can expect those peaks to be at those really worst case scenarios that I showed you. So we have a choice to make. Do we want to work on bringing that peak down, or do we just want to let this Omicron surge explode?
Thank you. We have a question from Jim Kurtzner. I'm going to allow him to ask that live. Jim?
Can everybody hear me? Sorry, I had to unmute. Can everybody hear me okay?
Yes.
With all of these cases, there's been a lot of talk about reaching the peak and where exactly does that put us. And I want to read this specifically. With so many people getting infected, could we be headed toward an endemic state? Or is another way to put that, are we going to reach herd immunity, where people can breathe easier, and so many people have gotten it that there will be a period of time where the herd immunity takes over and people can resume some normalcy?
Dr. Bagdasarian, can you address that?
Sure. There's been a lot of discussion about what is herd immunity and what does this mean to us? What does endemic COVID mean? And I'd like to start out by saying that it's not something magical that happens overnight. It's not that we reach a certain threshold and then all of a sudden we don't have to worry. Number one, we are not going to reach herd immunity during this surge. This is a very dangerous time for us, and this is not what we want to see with cases exploding the way they are. The second thing I'll say is that the degree of protection, the degree of herd immunity we have, it improves the more people who are immune. So that means the more people who are vaccinated, the safer it is for society, the safer it is for children under the age of 5 who aren't eligible for vaccines, the safer it is for those who are immunocompromised. And the other part I'll add is that this journey to herd immunity, this journey to endemic COVID, it's much safer if we rely on vaccine-mediated immunity rather than everyone coming down with COVID in January and February of 2022 and putting our healthcare systems at risk. Thanks.
Thank you, Dr. B. Unfortunately, we are out of time. We do still have several questions, and we will be noting all of those and doing some personal follow-ups. I do apologize, we're not able to follow up with everybody, but again, we will be sharing the recording of today's briefing, as well as Dr. Bagdasarian's slides with the email address that you used to register for the Zoom webinar. The video just has to process after this, and it should be to you in your inbox in about 15 minutes. Again, I've placed my phone number and email in the chat further up, so please feel free to reach out to me with any follow-up questions. And with that, please stay safe, and thank you so much for joining us this morning.